I'm going to jump right in and ask just first, the CBO has scored the replacement bill, finding that it lowers the budget deficit but increases the number of uninsured Americans. First of all, do you trust the CBO? I mean, some Republicans, Sean Spicer, have indicated they do not. How do you feel about the CBO?
Look, I don't criticize the CBO, but there's one thing that the CBO has to do. They can only score what's in front of them. This is the first phase in a three-phase plan that changes health care. They are very good when it comes to numbers for monetary that they see right in front of them, but when they're making projections in the future about who will have health care and who will not, those don't always ring true. Because if you go back to Obamacare, the number of people that they said would be on it is fundamentally lower today than what they projected. But they did project that premiums would lower, that your health care would actually cost less. They did project that the deficit would be lower because of this plan. So that's exactly what we're going to look forward as we go. And because they couldn't look at what we're doing in Phase 2 and Phase 3 that would help individuals making sure that they have health care, I understand why that score is a little different.
Okay. The CBO estimates that 14 million fewer people will have insurance next year if it passes. Now, even if we are to assume that perhaps that number could be a bit off, which it could be, who's going to pay for the bill when those people in that 14 million end up in the emergency room?
Well, that's a great question as we go forward, because we repeal the individual mandate. It's not in the Constitution that mandates that you have to have health care. But what we're going to do in this bill is provide you a number of options. Instead of government dictating one size fits all in the process, so maybe you just want a catastrophic plan. We also make encouragements, much like if you're a good driver, your insurance cost is a little lower, or maybe you have, from a standpoint that you don't smoke, so your health care is a little better. We put a provision in there. If you maintain health care, your insurance plan, you get a lower rate than if you pull off it. So it does create the encouragement to keep individuals on there without mandating, because you're going to find some people in that number just don't want to have health care in that process. But we're going to have catastrophic plans, so maybe someone just wants to take a catastrophic, but the price is really low, so they're willing to do it. Today, you've got such high deductibles in plans. Like I was just at a local business the other day, and he says, you know what? I pay the penalty because the health care is so expensive and the deductible is so high, I just go and pay the penalty. And that's what's happened nationwide when it comes to Obamacare. More people are paying the penalty today than actually taking Obamacare. So the real challenge here is how can we give people more options that lowers the premium so they can have health care that they actually pick, and more people service that way to actually provide as we go forward. And there's one other point I want to make, because I think there's been some misinformation out there. If you were on Medi-Cal, there are no changes in the process in California for the next 3 years. And in those 3 years, we provide the states flexibility and options with a cap within the money to be able to manage that. And I believe that will provide them much better health care, because the concern I have with Medi-Cal, not every doctor takes it. There's a long waiting line, especially when it comes to specialists. So how can we provide people a better health care system that actually costs less? And I believe this puts us on a sustainable path to make sure we're able to keep Medi-Cal for those in our community who need it.
Okay, and there's certainly a lot of people on Medi-Cal in our community. I think the last check was about 45% of the county. You mentioned nothing's going to change for the next 3 years, but after that, the amount of federal funding is going to be less. That's the way I understand the bill right now. As someone who represents a county with that many people on Medicaid, is reducing that funding the best thing that you can do for the people who live here?
Well, the best thing we could do is, looking forward, Medicaid itself is unsustainable, because in less than 10 years it'll cost $1 trillion just for 1 year, and that's all the money we spend in discretionary spending in the federal government, from the military, the Department of Ag, and all the way through. So it's unsustainable. So can we find a way that we can manage it better and provide better health care? When I listened to 18 different governors, Republican and Democrat, they said if we gave them flexibility, they can manage it better. So what we've done is we've gone in this path where we've gone 3 years to transition through it, so they'll see no change. then the funding is the same funding that we have been providing all along for the blind and disabled that when Medicaid was actually created for. We provide the exact same funding for that population as we move forward, the formula for California. But that flexibility for the next 3 years allows the states to start managing that better, provide better health care, because I hear from so many people that are on Medi-Cal that they have such long waits to, one, find a doctor, or two, especially to find a specialist. And they tell me, access is not care. So how can we have a better system that is sustainable in the future, because currently today it is not?
Okay. On this discussion about what is sustainable, because it's a very relevant discussion, you talked about some of the savings and whatnot. The criticism of this bill from within the Republican Party comes from those to the right, who say this is simply Obamacare light, Obamacare 2.0. Can you kind of reconcile that criticism from those that are more fiscal conservatives with this idea that it is going to be moving towards sustainability?
Oh, very much so. I mean, if you just read the CBO report, it saves more than $300 billion to the deficit. It cuts more than $800 billion of taxes. And the one element that nobody's talking about in the future is not just health care, but what Obamacare did to our small businesses and to the business climate. That it limited people that if they had more than 30 hours of work, that they had to go into Obamacare if they had more than 50 employees. So we saw so many small businesses cut your hours of work, so people had to start working 2 part-time jobs to survive. Well, that held people down. Or that they wouldn't hire beyond 50 employees. Well, that held companies and employers back instead of hiring new people. Well, that all gets repealed. So we repeal those taxes, repeal the mandate, but what we do continue to provide is pre-existing conditions, because we want to make sure people are cared for. Also, if you are 26 years or younger, you could still be kept on your parents' health care plan. So I think when people take a deep breath, sit back and literally look at what this bill does, yes, it creates the savings, puts it on a sustainable path, but at the same time, what the CBO report said that is so important here, it lowers the premiums. For too long, I've heard people talk about that they were promised from President Obama that premiums would go down $2,500, and they just saw the opposite. So they can't afford it. And then the deductibility went up to $5,000. So even though they spend all their money paying for a health plan, they don't use it because the deductibility is too high. We want to make sure America gets healthy, and this plan actually does that in a fiscally sound manner.
Okay. I think we got the last question here. Do you expect the Senate to make changes or to come back with sort of a counter bill to this? Is this kind of the opening of negotiations, or is this the bill you'd like to see put through as it is right now?
Well, just as every bill that we pass in the House, the way our system works is the House passes a bill or the Senate passes a bill. So they can amend, they can change. If they think they have something that makes it better, then they will do that, and then we will come together and vote on one final version. That's the way the structure is created. Senators or legislators, too. I'd really like the Senate to if they have an idea, produce the idea and have a vote on it. That's what we're going through. This bill has been through Energy and Commerce, through Ways and Means. It just passed budget today, and then it will go to the Rules Committee before it comes to the floor. The legislative process is an open process that you let the best idea win at the end of the day. And that's really what we're happening on this bill. I think before this bill comes to the floor, when it comes out of Rules Committee, there will be some changes to it, because we continue to listen to people, continue to want to make the bill better, because we want the very best health care bill that we can pass.
Okay. Thanks very much, Congressman. Appreciate your time as always.
Thank you so much. I appreciate it.